Hey everyone, and welcome. Today, we're going to dive into a topic that affects millions of families all over the world, but honestly, it's often really misunderstood. We're talking about congenital heart disease. So to get us started, let me ask you a question. When you think about birth defects, what's the very first thing that pops into your head? What do you think is the single most common type that babies are born with? The answer is actually a big surprise for a lot of people. It's congenital heart disease, or a CHD for short. And get this, it affects about 1 in every 100 babies born across the globe. That's more than 1 million infants every single year. So this isn't some super rare condition. It's the most common structural issue a baby can be born with. To help make sense of all this, we're going to break it down into 4 simple parts. We'll start with the absolute basics. Then we'll look at the causes and the different kinds of CHD. After that, we'll get into how it's diagnosed and treated, and finally, we'll talk about what it actually means to live a full life with it. Okay, so first things first, let's build our foundation. What exactly is congenital heart disease? Let's just break down the name because it tells you almost everything you need to know. Congenital, that just means it's present at birth. And heart disease, in this case, means there's a problem with the heart's actual structure, its physical build. So CHD is really just an umbrella term for any kind of structural problem with how a heart was formed in the womb. To really get a handle on what can go wrong, it helps to think of the heart kind of like a house, a really efficient house with 4 rooms, those are the chambers, and 4 really important doors, those are the valves. And these doors are designed to make sure blood only ever flows in one direction. And the plumbing in this house is, well, it's brilliant. It's designed for a super specific flow. So you've got blood that's low on oxygen coming into the right side. From there, it gets pumped next door to the lungs to pick up a fresh supply of oxygen. Then that oxygen-rich blood comes back into the left side of the heart, and bam, it gets pumped out to the entire rest of your body. It's this simple, elegant, and absolutely vital loop. So that's the blueprint for a healthy heart. But what happens when that blueprint has a mistake in it somewhere? Let's dig into the causes and the different types of CHD. The very first question families almost always ask is why? What did we do wrong? And the honest-to-goodness answer is that in most cases, we just don't know. For the vast majority of babies, there's no single clear reason why the heart didn't form perfectly. It's almost always just a random, complex event that happens during development. Now, that's not to say we don't have any clues. Researchers have definitely identified some risk factors that can increase the chances. Things like certain genetic conditions, or if the mother had an illness like rubella during pregnancy or was taking specific medications. But, and this is so important, these are just correlations. They're not guaranteed causes. Instead of getting bogged down in a bunch of really complicated medical names, it's much easier to just group the types of CHD by what they actually do to the blood flow. So some defects send way too much blood to the lungs, which can overwhelm them. Others send too little. Some create blockages, like a door that's just stuck shut, and others are literally like holes in the walls between the heart's rooms, causing blood to mix when it's not supposed to. Okay, so we've got a handle on the problem and the different types. Now for the really important part, the action plan. How do we find these things and what can we do about them? Finding a CHD can happen at a lot of different points in time. Sometimes a problem gets spotted on a routine ultrasound before the baby is even born. For other kids, a doctor might hear a little whooshing sound, a heart murmur, right after birth. Or maybe a parent notices symptoms, like their baby is breathing really fast, has a bluish tint to their skin, or is just having a really hard time feeding. Now, this whole journey can sound pretty intimidating, but it often follows a clear path. It might start with that first detection, which leads to an official diagnosis. Then a treatment plan is put together. For many, that's going to involve surgery or some other procedure in the first year of life, and that's followed by a lifetime of regular checkups to make sure that little heart stays as healthy as possible. And this is where the story becomes truly incredible. The medical advancements have just been astounding. I mean, think about it. Just 60 years ago, many of these conditions were basically a death sentence. Today, surgeons can perform these unbelievably delicate repairs on hearts that are no bigger than a strawberry. It really does capture that feeling of miraculous progress and so much hope. All that amazing progress leads us right to our final section. What does the path forward actually look like? Because it's no longer just about survival, it's about thriving.
The big takeaway here is that the care doesn't just stop after a childhood surgery. Living with CHD is a lifelong partnership with your health. That means regular checkups with cardiologists who get it, committing to a healthy lifestyle, and, this one's huge, as patients grow up, it's so important they transition from pediatric care to doctors who specialize in adults living with CHD.
And why is that lifelong care so important? Because it works. I mean, this number says everything. Today, because of early diagnosis and incredible treatments, more than 90% of babies born with a heart defect will survive and live well into adulthood. That is one of modern medicine's greatest success stories, right there. And that brings us to our last thought. The journey from a really grim prognosis to a 90% survival rate is it's staggering. It makes you wonder, right? With all the new technologies like 3D printed heart models, less invasive procedures, and huge leaps in genetics, what does the future hold? What new possibilities are going to open up for the next generation of kids born with a heart that's just a little bit different?